Well, hi there, it's Pete here from the Pain Toolkit, and I was sent some questions that I was supposed to give the answers to in a short movie. I'll be as short as I can. As I say, I was sent 7 questions, so we did the answers to them really. Question one was, could you share a little bit about your experience living with persistent pain, and what was it like in the early stages? Well, I'm going back to the early 90s now, and it's pretty bonkers back then. But by the emails I get from people now via the Pain Toolkit website, it still goes on. But for me personally, it was feelings of hopelessness, um, really frustrated with the NHS, and at some one point back in '94 was considering ending my life really. So it wasn't. It's pain's a weird one. Like it's not a pleasurable experience. So. But anyway, that's where I was back then. That was back in 92, 93, something like that. Now, question number two: what were some of the initial approaches to managing pain, and what impact that have on you? Well, like most people, saw the GP, several physiotherapy appointments, and I think there was a scan of some, I had MRIs and whatnot, seeing the orthopedic consultant, and but I was also looking for answers via the other therapies like physiotherapy and osteopathy. I went down a complementary route as well. But back then, I don't know what it cost now, but back then I spent about 8k, £8,000 on all those sort of therapies privately, etc. And the only reason why I stopped is because I just simply run out of money, really. Question three: what have been the most effective self-management strategies for you? Self-managing persistent pain. Can you describe in detail? Setting goals and action plans has been a key one. Pacing my daily activities, like most people with pain or even long-term condition, we're overdoers. We use our pain or our symptoms to know when to stop and start. So pacing's been a really key one for me on not overdoing. So by pacing my daily activities, I can actually do more throughout the day without actually increasing my pain or symptoms. Problem solving has been a key one as well because like most people in life, we all get problems, etc. But when you're living with pain or a long-term condition, they seem to get amplified. So learning problem-solving skills has been important. Meaningful movement, also known as stretching and exercising. I think they call it meaningful movement now because if a person chooses to answer emails from New Zealand, Australia, and Canada, America, and whatnot. So I do before I get into the emails. I tend to do some yoga, some simple yoga, and then I go down the gym for about an hour and do some strengthening exercises, etc. I swap things around a bit. I see things on social media. What you like, some movements. I really got into Tai Chi, Qigong. I don't know if you've heard of that. I really got into that of late. It seems quite interesting. As I become an older person, uh, it's nice. It's a nice way. It's not. It's exercise, but it ain't bonkers exercise as well. And after I finish at the gym, I go for a walk, go down to the station, have a cappuccino, and walk back to the van and go out and do some more walking later on. So to me, doing exercise means I don't have to take any medication. Pleased to say that I've not taken any pain medication since 1997. Yeah. Having a setback plan, like most people with pain, I'm a bit of an overdoer. I can still be now. So if it does, my pain increases somewhat. I've got a setback plan that I can fall back to. It's It's like having a spare tyre on a car. You get a puncture and you put another wheel, a spare tyre on, and off you go again. So it's important to have a setback plan. Oh, and the other one that really rocks my boat is I've got a motorcycle, fat boy, Harley. Got back into that in 2017 when I was diagnosed with prostate cancer. I don't know, my to-do list really increased quite dramatically. So going out on my bike is part of my routine as well. How do you learn these strategies? Well, very, very simple. I was lucky enough I got myself on the input pain management program in London. And what that program gave me was not only the tools and skills, but also the confidence to manage my pain myself. As I found as I've got older, etc., I think back then that was in '96 I went on there. So, but what all those skills that I learned have all been transferable as I got older. So, as arthritis sort of kicks in, and then obviously the prostate cancer, I've been able to adapt all those skills for the different health conditions. What resources do I use? Really, I'd say look at I'm a I like I see things on social media. I thought well I'll give that a go. I think also my work is quite important to me really, so I know that keeps me well as well really. So pick up a few tips here and there. Question 5: what are the biggest challenges or setbacks you faced in your journey to recover and self-management? The biggest challenges back in the day was the medical model. It didn't allow. I got myself on the pain management program, but that was like a best kept secret. Excuse me, in the NHS. So all I was offered, like it is still now, really, just the medical model. And all that really did was keep me anchored into, touring around the NHS. So I knew I would have ended up on someone's operating table, an orthopaedic surgeon or something like that. So really, back pain, the input program really saved my life, really, as I see it. What resources do I use still? I say I'm you never stop learning, really. So to me, I'm always on the lookout for key, some self-management skills. I talk to other self-managers from around the world. What do they do? How do they learn, etc. What do they do? What can I improve on, etc. So to me, hey, listen, the easy way to put it really is that I've got two jobs. My first job is I'm a self-manager, so I've got to look after myself. And my second job is doing all this other stuff with the pain toolkit. Number 6: what encouragement would you give someone who feels overwhelmed and hopeless about their persistent pain? I would say avoid doctor shopping, therapy shopping. Plenty of therapists out there who, I don't know, and I'm not rubbishing anybody, but there's tons of stuff out there now. I call it a lot of noise. There's a lot of noise out there. Come and do this. This will happen. But to me, it's about avoid that sort of stuff. And really, what I always say to people is find yourself an experienced supported pain self-management coach. They're very few and far between. And that's why we started up the academy, so that we can train up more healthcare providers so they can go out there and support people living with persistent pain. I think also people, they need to be resilient, have the willingness, stay focused, have a purpose. I think when you're living with pain, etc., we lose our purpose. So have a purpose, have a goal, etc., and keep renewing the goals. Like you've got to keep moving forward. As I call it, get yourself back in a driving seat, get back on track, etc. So what does it mean? Number 7: what does self-management of persistent pain mean personally? Independence, mobility, maintaining a purpose. Become a habit, really. It's like brushing your teeth. You know, I wouldn't think about going out anywhere without doing my stretching first or whatever. Um, so it's become a habit, and that's what really we need to be encouraging others to do. Really make self management fun as well. I know I always have a bit of fun as well. So going out on my bike and whatnot, and stuff like that. Anyway, hope you found that useful, and I dare say I'll see one of you or two soon. Take care, bye.